Welcome to Parker Adventist Hospital TV. I'm joined by Dr. Matthew Metz, a fellowship-trained bariatric surgeon and medical director of the Bariatric and Metabolic Center of Colorado. Dr. Metz, what is bariatric surgery?
Bariatric surgery is surgery for people that are struggling with their weight. It's not for everyone. It's reserved for patients that are about 80 to 100 pounds overweight and have been struggling with their weight for a significant period of time.
And what types of procedures do you perform?
The three major operations that we do here at Parker Adventist Hospital are the gastric band, which is a laparoscopic procedure where we put a small band around the upper portion of the stomach that's adjustable for each individual patient. There's also the gastric bypass, which is the most commonly performed bariatric surgery here in the United States. In that surgery, we make the stomach quite small, about the size of an egg, and we hook the intestine directly up to it so that it restricts the amount of food that a patient can eat and reduces the amount of food that a patient absorbs from their diet. The third operation that we do commonly here at Parker Adventist is the sleeve gastrectomy. That's also a laparoscopic procedure with 5 small incisions, and in that procedure we make the stomach sort of hot dog shaped, a very small skinny stomach about the width of my index finger. That surgery also helps restrict the amount of food that a person can eat.
So the big question is, who is a candidate for the surgery?
Well, that question is determined significantly by a person's body mass index, or BMI. And the BMI is calculated by dividing a person's weight in kilograms by their height in meters squared. That math is pretty difficult to do in one's head, so we usually refer patients to the internet and ask them to just type those numbers into a body mass index calculator to find out what their number is. If the number comes back greater than 40, or greater than 35 with at least one major medical problem associated with their weight, such as diabetes, high blood pressure, or sleep apnea, then that person would be a candidate for surgery. It works out to being about 80 to 100 pounds overweight.
Dr. Metz, thank you so much for answering our questions for us.
Thank you for having me.